Hello, everyone. Welcome to Health Professional Radio. I'm your host for today, Tabitha Moretto. Our guest today is Robert Reed, CEO of MedAdvisor. He joins us today to talk about the founding of his company. Without further ado, welcome to the show, Robert. It's so nice to have you here.
Thank you very much, Tabitha. Great to be here.
My pleasure. So, Robert, tell us something about your background.
So the background of MedAdvisor is really interesting. It was founded by Josh Swinnerton in 2012 because he had a mother who was battling a number of chronic diseases, Parkinson's and rheumatoid arthritis, and was forever shocked that scripts needed to be managed very manually. They didn't know when scripts were ending, that she would forget medication, she'd forget when to take it. And he thought that it was crazy in this day and age that when we can do mobile banking very easily, that we can't seamlessly link in with our medication records and medication management. So he had been working in the US on a number of different pharmacy-driven platforms and built a team in Australia, in Melbourne, to solve this problem of how to better control medication management for patients, and in doing so created a fantastic platform that is highly automated and intuitive and gives patients real-time access to their medication, connects them in seamlessly with their pharmacy and their GP, which leads to a great sense of control for the patient, but most importantly, a really significant boost in convenience, and that drives incremental adherence. So his original notion, I think, was quite surprising that it hadn't been done in a holistic way in other markets, and so he saw a great opportunity to build this product out over the last 6 or 7 years.
That's wonderful. So can you tell us, how did MedAdvisor came into existence exactly?
Yeah, so MedAdvisor's purpose really is to relentlessly innovate to improve access and convenience to healthcare, to help people feel better. And when Josh founded the company, he was able to attract investment from a number of seed investors and then some pharmaceutical groups in the early days, and then subsequently we publicly listed in Australia. And what the problem that MedAdvisor is really solving in the broader healthcare system is that of overall adherence to chronic medication, which is, as we know, and a lot of healthcare practitioners realise, is very poor. The World Health Organization estimates that about 50% adherence to medication for chronic conditions exists in developed countries. So it means that patients are not getting the healthcare benefits that their doctors want them to have. And what MedAdvisor has been able to do is to demonstrate through hundreds of thousands of patients on the platform that they can lift adherence by in excess of 20%. And we know that this is going to have a significant impact in the healthcare systems that MedAdvisor operate, and it has some very significant benefits for patients because they are healthier by definition of taking their medication more. They feel more in control, and they've got a more convenient healthcare experience because they, in the MedAdvisor case, they can order in advance, so they don't need to wait until they get to the pharmacy to find out whether the pharmacy has stock of their particular medication, and they don't have to wait for that pharmacy to dispense that product because they've done it all electronically, digitally in advance, and that's a big time saver for patients. And also when they go to their GP or primary care physician, they can also save time from repeat prescriptions that can come through the app as well. So it's a really convenience-driven proposition that has a fantastic side effect of improving healthcare outcomes and improving adherence.
Yes, it sounds great. Especially nowadays, people are so busy. But with your company, people are able to have their medicines in a faster way, and also it is more convenient for them.
Exactly right.
So tell us, how does your existence in the healthcare market help healthcare professionals in particular?
One of the big challenges in the healthcare market is that a lot of systems don't talk to each other. They're very fragmented. They're often very paper-based, and therefore can be challenging to get a really efficient workflow happening in different healthcare settings. The digitisation of health can really help that. And certainly in the pharmacy market for us in Australia, what that means is that orders are coming in advance, which means that they can dispense product before a patient gets there, which means that when that patient gets there, they've actually got time to talk to that patient and counsel them effectively, which has the added benefit of also building loyalty to that pharmacy, which is a really important aspect for their businesses as well as the service they offer the community. It also allows them to conveniently communicate with their patients when they need to. Let's say a drug recall, they can send out notices to all their patients on that specific drug to make sure that they come back into store. So it can be an efficient way to handle day-to-day activities that do occur in the pharmacy setting. On the GP side, there are a lot of repeat prescriptions. In Australia, there are over 100 million repeat prescriptions a year. I think 19.3 million repeat prescriptions, appointments for primary care physicians and GPs for the purpose of the repeat prescription. And that can take up a lot of time for GPs and can be inefficient use of time. What MedAdvisor does for GPs is provides a view of a patient's adherence to a particular medication, so they get improved information to make clinical decisions with, and also allows them to do remote script renewals when it is clinically appropriate to do so that they can focus their time on the patients that really need their care. And of course, we make sure that the GP is also paid for those electronic appointments. So it really boosts efficiency, standardisation and communication with patients to create a better outcome and working environment for both the healthcare practitioner and for the patient.
Wow, fantastic. It's good to know that MedAdvisor is leading a digital healthcare revolution.
That's right.
Thank you so much for your time. I'm sorry we don't have much time left, but before we go, Robert, what is your main takeaway message to all of our listeners out there? What would you like to tell them?
I'd like the listeners to really think about how they can embrace technology to enhance their connection with their patients. And we know there's a lot of friction in the healthcare system. We know there are a lot of tools out there that can help improve the customer convenience and increase efficiency from the healthcare practitioner through better sharing of information. It's one of the reasons why we're also linking in with hospitals to improve readmissions rates and also the admission process, where we can more effectively provide information to those healthcare practitioners and technology as an opportunity to provide better care to their patients.
That was a fantastic message. And lastly, for those who want to get in touch with you, how can they do that?
The best way to do it is through our website, which is medadvisor.com.au, and all the information about our business, about the platform can be demonstrated on that website. So from a consumer perspective, they can see what the app contains and all the information and the functionality of the app. And then from a healthcare practitioner, there are also pages on that website that they can also access.
Wonderful. Thank you so much, Robert, for coming on the show. It was fantastic having you.
Absolute pleasure. Thank you for having me.
And that was Robert Reed, CEO of MedAdvisor. If you like this interview, transcripts and archives are available at www.hpr.fm. We're on all social media platforms, so don't forget to follow, like, and subscribe. Show us some love by subscribing to our HPR YouTube channel. We're also available for download on SoundCloud and iTunes. I'm Tabitha Moretto, and you're listening to Health Professional Radio.